Okay.
Right.
I'd like to welcome everyone to the
Wait, not yet.
first
Okay, we're good.
meeting of the subcommittee
Hi, this is Riley from Delegate Rosenberg's office.
on government operations and health facilities. This is our first virtual meeting, so we're all in this together. We're all rookies together. We have 3 bills. We'd also like our staff today and for principal staff for the subcommittee will be Tyler Babbage. Did I pronounce it correctly the second time? Yes, okay, good. And Aaron Hopwood. So let's begin with House Bill 130. Tyler, could you summarize the bill for us?
Sure. House Bill 130 is from Delegate Key establishing LGBTQ Commission on LGBTQ Affairs. There was a very similar bill introduced last year, passed out of committee and out of the House. I am aware of one difference between this bill and the prior introduction version that was passed, in that in part of the bill which provides for who will be appointed as commissioner, or to the extent practicable, different identity groups that should be represented. This bill will also push for the inclusion of 2 transgender individuals to serve as commissioners, in addition to the other diversity requirements of the board. And so that's the only change from last year's bill that I noticed.
And what was the vote on the bill last year in committee and on the floor?
In committee, it was 17 in favor, 5 opposed. And then on the floor, I accidentally closed out of that vote. So let me pull it up. My apologies. The floor vote last year was 104 in favor, 28 opposed.
Okay. Does sponsor wish to add any remarks?
I am just very grateful for your committee's work last year, but for the pandemic, I was confident that it would have passed. I feel deeply committed to causes of advancing equity and justice so that people like my son would feel more at home. And this is very personal to me. I think it's past time that Maryland has a commission like this, which is a home and a liaison for our diverse communities from the LGBTQ Marylanders to be able to advance the coordinated agenda across state government, because there are so many laws that have been passed, but we really don't know how we are doing and how the community is benefiting from the work we're doing, how well they are served. So I think this is really an important first step. And the governor's office already has similar entities like this. So it's an appropriate home for this organization, for this commission, which is all volunteer based other than one director. So we basically emulated the current structure of other commissions. Thank you.
Thank you. Is there any debate?
I have a question.
Oh, question, certainly.
I guess for staff, one thing, I voted for it last year, but one thing that caught my eye was in the bill, it prescribes that the committee should or could lobby local government. And I'm curious, in the state government article, with other similar entities that are established, I have a bit of a concern having the government setting up an entity that is staffed and financed by the government to lobby other governments. So is there a precedent for that? Is this unusual to create something like this that would establish basically an entity that can lobby using public resources?
Do you want me to respond, or do you want?
Yes, please. I'm sorry. Yes.
Okay.
Delegate, she definitely feel welcome to respond, but I was curious.
Okay.
I don't have the state government article in front of me. I could pull it up, I'm sure, but it's something.
Yeah. So the GOSI, the Governor's Office of Community Initiatives structures, basically are by governor's appointment, and I used to chair one of those commissions. So the so-called lobbying is really advisory and advocacy function so that the governor and his office staff would be well aware of what's important and the state agencies will be well informed of the policies. So that's like an internal advocacy role. It is not to say, there will be an independent advocacy arm or something. It's just a matter of interpretation. I know how these things function because I used to work there as a volunteer, of course. Yeah.
So I agree with you, and I'm comfortable with that. The thing that caused me discomfort, I'm getting to it very quickly here. Here. Okay, so it says on page towards the bottom of page 4, the commission shall, and then on the page 5, number 4, work with local governments to pass laws that are inclusive. And of course, I'm not against that. But what I'm concerned about is I'm just curious, do we establish state entities? Is there a precedence for that in the state government article for any of the different groups that we've established to then, it says work with, but is that something that we do? I'm comfortable that we're asking it to be done for state agencies, but I'm curious if this is something that is done elsewhere in the code where we're establishing a group that would then, it says work with, but it seems to me that it could be lobby local governments. Do we know if this is done elsewhere with other similar entities?
I can tell you that, first of all, I don't know what's written in the code for other similar commissions. And I assume the language is borrowed categorically from whatever is already in GOSI. And I can tell you in reality, given there is only one staffer put in for each commission, the reality is all they can do is advisory and coordination. And if in the future we decide to fund it and build upon this, that is the state's decision. But as of now, the volunteer-based commission is to be an internal advocacy arm and a coordination body in terms of collecting data and coordinating with the local governments to make sure that we collectively advance the LGBT community's interests and agenda so that they could be just like the rest of us. And feel like they belong here. That is essentially the goal for all of the GOSI's commissions.
Delegate Kipke, do you have anything further?
All of them will change.
Well, I agree with Delegate Chi, which is why I voted for the bill last year. But
yes, thank you.
I would just like to know the answer. Do we set up entities that have the authority to then lobby local governments? Tyler?
I will look into it. I can't confirm that without double checking through existing statutes, and I'll get back to you as soon as I can.
Well,
Mr. Chair?
Yes. Delegate Barron? Yes, thank you.
If I might, just on good morning, everyone. Just on a hunch, I pulled up the website for the Maryland Commission on Women. And I'm not sure if this is in statute, but they have a legislative committee. It says one of the standing committees of the Maryland Commission for Women is the Legislation and Public Policy Committee. That committee builds a legislative agenda in collaboration with the governor's legislative office. And it goes on to say during the legislative session, you'll be able to visit the site for more information about the commission and the bills that they're tracking.
Where are you reading? Are you reading this from their website? You're not reading it from the statute, I assume.
Right. I don't know if this is in statute. Haven't
This is very different.
done that much research, but
Oh, understood.
I'm guessing that I wouldn't be surprised based on what I'm reading on the commission's website if they had some language similar to what this bill does have. But in any event, it doesn't seem unprecedented that, we have a commission that is working with the governor's office on legislative efforts.
This is different, though. This bill does have that, and I appreciate that, and I think that's appropriate. But what I'm just a little concerned about is creating a precedent, if it doesn't already exist, where we're authorizing a state entity to then also lobby local governments.
If I could just point out the big difference between this commission we're trying to establish under the Governor's Office of Community Initiatives versus an independent commission like Commission for Women, which has its budget and its staff and advocacy, legislative advocacy role. There is a big difference. The GOSI commissions are all volunteer-based. They don't usually have dedicated staffing on legislation and agenda. It is a place you go for, promoting state resources, to be a home for the people who know where they can go for services, and to coordinate communication and advance the collective agenda by working through government and the community resources. So at least at its initial stage, is not going to be able to do what a Commission for Women is set up to do. I hope at some point down the road, we will get to that point, but let's take the first step.
Well, I think Delegate Kippy is raising a reasonable concern, and I think we should see what other commissions, comparable commissions, governor's commissions, what the statute does or does not say. So if there is no objection, I would suggest that we put this on hold till we get that information from Tyler, from staff, and that it would be then circulated to everyone once you have it. And then this bill would again be on the agenda for the next time we meet, which I assume will be, I don't know for sure, but I assume we're pretty much going to expect to meet every Wednesday. So that's what I would propose. Is there any objection?
No objection, but can I ask a question to be, I guess, studied in that time period, or if maybe Delegate Chi can answer it for me, because
Go ahead, certainly.
It says on page 4 of the bill, a member of the commission may not receive compensation as a member of the commission, but entitled to reimbursement. But then in the fiscal note, and I'm just confused, so I want some clarification. There's a salary of $54,000 that goes up to $98,000. Who does that salary go to?
It's for the director of the commission. So a lot of these commissions sometimes share a director, sometimes has one director for the commission. So depending on the scope of the commission, this is for that one single full-time staff that would be employed to manage the whole commission's work. And that's the only paid staff.
Okay, well, thank you for the clarification.
Yeah.
Okay, good question. Thank you. All right, so we will put this
Mr.
bill on
Chairman?
hold. Yes, I'm sorry. Yes, Delegate Johnson.
I also wanted to cover some ground before we put it on hold, so
Certainly,
the sponsor might have a chance to look into it.
certainly.
Following up with Delegate Chisholm's question, and from what we've learned in the past from board. On page 4, it did say may not receive compensation as a member of the commission. Page 5, it says the commission may accept gifts, grants, donations, bequests, endowments for any of the purposes. So I just don't want to create another commission or board that's going to have a problem with commission or board members except getting gifts and things that may put them in a bad light, and certainly us to set up a board that has the potential to get in trouble. So is there some clarity on the comment on page 4 where they may not receive compensation, but on page 5 where they may receive gifts, grants, donations?
Well, the commission, individual members are not allowed to accept anything, but as the commission as a whole can go after grants, can leverage community resources. That's what that means. And it functions very much like all of the other commissions, So I think for clarity, the committee, your committee might want to look into what it says about other similar commissions. And I recommend that if you're going to do that.
All right, thank you. Thank you, Mr. Chairman.
Thank you. That's Delegate Key. That's just the point I was going to suggest. So Tyler, you have another additional research to see if this is found in other comparable statutes. Okay. Any other discussion? Okay, House Bill 130 is on hold. We will await for
Thank
next,
you.
and we will share with the full subcommittee Tyler's research. Okay. House Bill 297, Maryland Lynching Truth and Reconciliation Committee. Tyler?
This bill would extend the sunset provision and deadlines, reporting deadlines for the Maryland Lynching Truth and Reconciliation Commission. It has no fiscal or minimal fiscal impact. It'll be able to function on existing resources, partly due to the commission received a grant from the Department of Justice in October that will help them continue their work.
Does the sponsor wish, how does this bill compare to the bill from last year?
It's not a reintroduction. It would,
Oh, okay, right.
The bill, the commission already stands. It's just extending their deadlines.
Okay.
Move the bill.
Thank
Okay.
you.
Second.
Okay. Thank you. I just want to make sure, thank you so much, that the date that is done is the date that the commissioner, the person in charge of the commission suggested, not the one that I had, because they wanted extra time because of the grant they got. We have never given them a penny, and they got $300,000 from the federal government just this past fall to do their work. So thank you all. And I know, Nick, you helped me draft that initially, and Kathy, you guys were on board early on. So thank you so much. So Tyler, is the date the one that the commissioner suggested, not the one that I have? He wanted more time than what I had given.
I don't have, I don't know exactly which date
Is there a testimony from the person in charge, the director of the commission? There's
I believe I have that.
yeah. So that's the date. I just want to make sure we get it right. He wanted, I don't know if you see it.
Yeah,
I don't
he
have
wanted-
The
the,
letter says
Wants it.
extending the termination date to June 2024 and the
yes.
report submission December 2023.
Yes, that's what he wants, and that's what I would respectfully ask this subcommittee to honor, so that we don't have to come back again.
I move
Or-
favorable on Delegate Pena-Melnick's amendment.
Second.
Okay. Second, is there any further discussion on the amendment? None, the amendment is adopted. Is there a motion on the bill as amended?
Move the bill.
Move the
Second.
bill.
Second.
Okay. I guess let's try and do this as we do in committee, full committee. All those in favor, say aye.
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 Right? Anyone opposed, please raise your hand. Raise your hand or use which are we doing in committee? The little icon? Huh? Are you in, was that a Kathy, Delegates Liga? You are in opposition.
No, I'm not. Sorry.
You're just showing me what
I moved
the
it.
icon is. Okay.
Okay. I'm in favor.
Okay, so it's unanimous. Fine.
Thank you.
Next bill, House Bill 390. Maryland Harford Memorial Hospital Closure Economic Impact Study. Aaron Hopwood.
This bill requires the University of Maryland Institute for Governmental Service and Research to conduct a study on the economic impact of the closure of Harford Memorial Hospital and Havre de Grace and the subsequent transfer of its services to another campus under the University of Maryland Upper Chesapeake Health System. The bill also requires the Institute to develop a revitalization plan for the city of Havre de Grace. If I'm saying it right.
Well, sponsor, you wish to speak?
Mr. Chairman, this bill is to help in the transition. The Harford Memorial Hospital has been in Havre de Grace over 100 years. And during that period, they have paid no taxes to the city of Havre de Grace. They're moving and transforming it into a freestanding medical facility in Aberdeen. So they're leaving the city. They are the largest employer in the city of Havre de Grace, along with the ripple effects of all the doctors' offices, radiology clinics, all that go with that hospital. So what we're trying to do is get an impact study so the city of Havre de Grace will be able to make decisions on their infrastructure, on what they need to do and how it will impact their city totally to fill that 9-acre parcel that will be left as a hole in the middle of their city when this hospital shuts down. They need to redevelop that site. They need to know what they need to do to get ready to redevelop that site to make sure they don't lose a devastating economic impact in the city. And that's what this is about, for to be a partner and get an impact study done so that everybody knows what they need to do to be able to, the hospital to sell the site, the city to be able to help revitalize and redevelop the site, and for the city to not lose all of the economic impact that would affect their businesses, all the businesses in the city.
Are there questions of the sponsor or further? Delegate Hill and then Delegate Young.
Thank you, Mr. Chair. Delegate Johnson, this question came up and I just didn't hear the answer during, or at least an adequate answer for me during the hearing. And the question is, why is this the responsibility of the university and not the responsibility of the jurisdiction?
Well, I heard during the hearing from the University of Maryland that this was a local matter. However, I tend to think differently because this was a public-owned hospital until it was purchased. University of Maryland, now it falls under their umbrella, which is a type of quasi-state entity. The governor appoints all the board. We have 2 General Assembly members on the board. They also receive state funded money. And the state quasi-entity is the one who shut the hospital down in Havre de Grace and is going to move it to a freestanding medical facility elsewhere. So it's not just a local matter. I hope that answers your question to the best that I can.
Okay, so I guess the issue is the local matter. I'm not talking about the fact that it moved and the community was impacted. I'm talking about the need to come up with a plan for how you revitalize, because I'm not clear how this doesn't become precedent setting so that everywhere in the state when a business moves, for instance, when GE moved out of Howard County 2 decades ago, that before they move, they'd be responsible for doing the impact study for Howard County about how Howard County is supposed to make up for that loss. That's really the question. Why is this, what's to distinguish this from any other entity leaving?
And honestly, my answer to that would be, just because we've been doing it wrong in the past doesn't mean we have to continue to do it that way. I think that every major employer that moves out of a community should be required to do an impact study to know how we're going to handle the holes that are left behind. That's my opinion, and my past experience with economic development. I see the impact that companies have when they pick up and move. Now, we're not arguing the fact that it's a business decision where they want to be. But again, they have profited from being in Haverty Grace. They have paid no taxes for over 100 years. And I don't think that's an unreasonable request, even if we do set a precedence that a major employer that pulls up and moves out of a community or shuts down do an impact study so we know how to move forward as a community wherever that business is.
It's anyone else who has, yes, Delegate Young, you had a question?
Delegate Hill just asked my question.
Okay.
Hopefully I answered it to your satisfaction.
Okay, I have a question of staff of Aaron Hopwood. Is a study already underway by UMD?
No, they hired Cushman Wakefield 3 years ago to do a study, but it was a property study. It was not an impact study. And since then, they have shared a few slides of that study with the city of Haverty Grace, but the city of Haverty Grace still has not been privy to that entire study. They are working better together now. But no, they did not do an impact study.
Well, do you know, how could we perhaps facilitate better conversation between the hospital and the city?
I'm open to any suggestions, a letter from the chair, a letter from our committee. I mean, I'm open to any suggestions. The whole idea is to make sure we help this community transition. If that can be done another way where we're all working together, I would be all for that.
I got a question.
Yes.
So it says, since you brought up Cushman and Wakefield, it looks like they did some sort of a redevelopment plan. Is that correct?
They are handling, now the hospital has turned over the whole project to Cushman Wakefield to market the property, to find a buyer. So they have come up with a possible plan for redevelopment.
Well, that's why I asked you.
The city needs to know, do they need to upgrade their infrastructure? What the city needs help to know what they need to do to make something like that happen. And that's what this bill is about.
Well, that's why I asked, because in a redevelopment plan, typically they're going to tell you, all the market forces that are being brought into play, what type of market they're looking at, what type of education, what type of age group, what's going to best fit there. Their job is to figure out what's going to best fulfill this need. And I don't know if that is going to be any different than a study, to be honest with you. I could be corrected, but I don't think so. I think those redevelopment plans, especially when you get into somebody like Cushman and Wakefield, who's very prominent, they do very extensive studies and redevelopment plans within that, and they look at all aspects of it. I'm just concerned that we're getting the same answers from two different places, but we're spending state resources on a local project. I mean, I understand the concern. You never want to lose that many jobs because it has a major impact. And I understand the tax implication part of it, but that was put into place 100 years ago. I don't know what the study is going to tell you tax wise. The new plan, if it's a marketable property, the tax revenue should go up quite a bit. That's my opinion.
That is, and hopefully that will help the community if something goes in that is not a nonprofit that will pay property tax. The study more goes into how it will affect the surrounding businesses, what the infrastructure needs would be for a development like that. I have had a meeting with Cushman Wakefield and saw the plan that they did, and it is a plan. They looked at what the market is looking for, what value, for instance, homes or townhouses would be in that area. They look at what they could market the property to a developer for. as far as getting into the infrastructure, the tax effect, even the water usage, that's the largest water user in the city. So now even the water bills will have to be readjusted and spread out to all the community. So a study, impact study goes way beyond just looking at a market study. But Cushman Wakefield did do a market study, and they do have a plan, a drawing of what they think will do well there. And again, this is to help, an impact study would help the city prepare for the property for whatever can go in there, whatever the market demands.
Well, typically, if it's a marketable property, the developer's going to pay for all that infrastructure. The developer's going to pay for those water upgrades, the sewer upgrades, whatever it might be. And being that in the state of Maryland right now, we have a terrible shortage on real estate and other properties, I would think that they're probably going to line up because it is a very attractive city. I love Haverty Grace, and I think that it would be filled pretty quickly. And a lot of this is not going to fall on Haverty Grace. It's going to fall on the developer, I'm sure, if it's like any other city or county agency that I deal with. So just a point I wanted to make that I think that.
No, I get it. And a developer is responsible for anything on site, the infrastructure upgrades on site. But getting the infrastructure to the site would be the obligation of the city.
Right. Okay.
Mr. Chair.
Yes, Delegate Sample Hughes.
Hi, I think my hand is blending in with my credenza. But I did, I did want to, you're fine, I'm patient. I did want to just give this statement in the sense where Delegate Johnson, I understand where you are in your processing and your thoughts, because in City of Cambridge, we had the exact same issue and the same concerns. And it's taken a whole lot of heart-to-heart conversations and meetings in the communities and having the community engaged as to what they want to see on the property where the old hospital will soon sit. And the new hospital is in transition right now and should be completed in July of this year, right there in Cambridge on Route 50 with so we're in the same boat. So I think a plan forward could be that, you know, the information that you're seeking can rest within the local perspective, and getting that from the city government and help asking the assistance of the county government as well, to help in the same vein and not go through the process of having a bill per se. I think you can get there. I think it's just going to be some strategic planning and some holding folk accountable to be at the table, being this is a new transition for your community. But I think we can do that by way of not having a bill, but it's doable. It's doable. So I'll just leave it at that because I know what you're going through, and another part of the Eastern Shore is as well over in Kent County with another hospital that and so I think we can get there, but we just strategically make it happen so you can go back to your constituents and show that we have a plan forward. Thank you.
Thank
Mr.
you.
Chair.
I would, anyone else? Let me see if I can. Delegate Hill.
Thank you. I was going to ask the chair, the chair, if it's possible, and the delegate, if he think it would be helpful. And I know that people have contracts, and that's why I'm saying if it's possible for the chairman of the committee to send a letter asking that the full report that was commissioned from Wakefield or whoever else did the report be released to the city, that they get the full report, and that both parties, both the university who commissioned the report and Wakefield who agreed to do it, sign off. That, you know, is it possible for the chairman to ask them to share that report, for both parties to agree that that report should be fully shared?
I think that's a reasonable request, and I
Would
will.
that help?
I don't know if the letter will. It's up to the chair if she wants to do the letter, if she wants me to sign the letter. But I think that's the route that makes sense. And certainly I would share that letter, draft of the letter with Delegate Johnson before it goes out, and for sure.
Delegate
So-
Johnson, would that help?
Absolutely, I think it would. Last year, the request was made that we sit down and try to work it out, and they share the study. But I didn't happen. I'm not going to say purposely because of COVID was involved, and in their we're pretty busy. But yeah, a letter. If I could get a letter, I think that may help.
Good. So could we have, is there a motion with the understanding that there would be a letter to be drafted by committee staff and we will see if the full committee chair wishes to sign it, or if
How about if it's okay if I make a motion to hold the bill so that you can discuss it with the chair and see what, what she prefers to do?
so is that the will of the committee as opposed to unfavorable with the letter?
Yes.
Oh,
Okay.
I'm favorable with the letter is fine. If that's what you're gonna do, that is fine.
Well,
Favorable is fine.
Well, then may I ask the question of Delegate Johnson, would he prefer to withdraw the bill pending a letter or to get a vote of unfavorable? What serves you better to say that you couldn't, that it was voted down, or that you worked out something and withdrew the bill to
Well, my whole goal is to help the community with the transition. If we don't have the support of the committee, I would be willing to withdraw the bill with the letter of support for the city getting the full study that from Cushman Wakefield.
And I apologize, I didn't know there was a motion. I heard you say, do we write a letter, but I wasn't sure there was a motion, Senator Delegate Rosenberg.
Oh, that's fine. That's fine. So Delegate Johnson, just so I can be clear, you're willing to withdraw the bill if the one particular thing that needs to be in the letter again is, say it again, please.
That Cushman Wakefield share the full study that they've done with the City of Haverty Grace officials.
Okay, that's our request, and that's the heart.
And may I add, Mr. Chair and Delegate Johnson, I think that, and I don't know this, I'm not the attorney on the committee. We have several good ones, excellent ones, but I think that that's going to require asking both parties to release, to give a release that the information can be shared. It's not just going to be on Cushman Wakefield. I think
No, it will be up to Upper
contracting party.
Chesapeake.
So we have to ask them to release. They can't share. I'm sure they have a document.
Correct. That will be up to
Disclosure.
University of Maryland, Upper Chesapeake.
Right. And just to add, I think that goes back to that accountability piece. We can hold people accountable because there's a lot of things that they need from us. And this is very important. And we just need to add a timeline on there for you, Delegate Johnson, so you can get what you need to stay in line with your community.
And I think, in fact, to the Speaker Pro Tem's point, if we hold the bill and we put a tight timeline on that, because the report's done, it doesn't take long for them to release it. And that is that we still have a position that we can move forward on the bill if they don't agree to what we're asking in the letter. So I would.
Well, I heard Delegate Johnson was ready to withdraw the bill if the letter is sent. And that's a letter that would be.
Mr. Chairman, if we could table the bill until we get the letter out, I would rather go that route. That's, I think, as long as, like the committee members have stated, that we do have some type of control over the matter. I think that would be probably the best way, and there really is no reason for them not to release the study to the. So if we could help make that happen.
Okay. That's fine.
I think that
That's
would be
fine.
the way I
That's fine.
prefer to go.
Reasonable
hold the bill.
compromise.
We will hold the bill. We'll have a letter drafted. I will talk to the chair and also talk to the sponsor of the bill, Delegate Johnson. Such letter goes out.
Thank you, Mr. Chairman. Thank you,
Pleasure.
committee.
Pleasure. There being no further business, we stand adjourned. Thank you all.
Thank you.